Okay, let me just put full screen. Okay, all right. So the topic, yeah, I will present is on practice management. Okay, so especially on building a successful practice. Okay, problems and solution. That's always my focus. Finding the problem and then finding a solution. Okay. So what problems that usually people face at their practice? Okay, this is mainly concerning those in the private practice, but also may be relevant at some point for those in the government practice. Okay, so trying to do too much. Okay, overbook patients, run from clinic to clinic. Okay, it just sound like Dr. Anis mentioned, a doctor got few clinic he's running from one clinic to another. Okay, and then being late and so on lah, caught in the jam, no parking and so on lah. Okay, last minute patients and so on. Then because of this stress and all that, sometimes we don't behave appropriately with the patient. We are rude to them. Okay, or they perceive us as rude. Okay, and because of the stress also, we shout at the staff and also okay, and we try to do everything. Okay, there's a problem. Okay, and we don't delegate. Okay, I've been to practice where actually the doctor do everything. Even apa nama, uh, you know the even the staff doesn't know the registration number of the clinic. Okay, um, and doesn't know how to to actually help to fill up this the notification. Okay, they don't know what is the password and so on. So I mean, of course, notification you have to fill up, but at least if some locum doctor come, at least they should know about it lah. We cannot be like not doing it. So do you know the fine if you don't notify within 24 hours for most disease? Anyone knows? Anyone? Will you be fined if you don't notify within that schedule? Usually 24 hours lah. Huh?
1,000
Yes.
is it?
1,000 for dengue.
Yeah.
1,000 per dengue and the others?
Not
Others,
sure.
1,000 for dengue.
Yeah. Okay.
Doctor, generally dah revise dah. Starting from this year, it's no more 1K, 5K already for all the infectious disease.
Okay. So be very careful. So especially those in the government also be very careful. So and those in the private sector, okay, you don't notify, that goes your maybe your profit for the month in some practice. Okay. So it's a lot of money and not defendable lah, as I said, as Mr. Ranjan will say. Judge will throw out your case, not defendable. Okay, so need to notify. Okay, so notify is very important. Okay, and list may be revised from time to time. Okay, so the common disease that you need to notify, of course, dengue, number one. Influenza, still you must notify. Okay, and foot mouth disease lah. I think that are the three main common one. Of course, others you have to see the list lah, which one you need to notify. Okay, all right. And another problem that we see in practice is the undisciplined and disorganized lah. Okay, the even the doctor's room, you can't find anything. Okay, if you come as a locum or something, you can't find anything. Okay, you can't find, where is the otoscope, where is the ophthalmoscope. Okay, where is the you know uh, even torchlight, the battery is run out and so on. So all this should be checked lah, on the daily basis. So make your practice organized. Okay, it just gives you an impression if you're working locum at a clinic. Okay, then batteries not working, for the otoscope or thermoscope. You wonder what the other doctor were doing. Was he looking, or he or she looking, using the thing and all that. So you just wonder for what. Okay. Okay. So actually, the actual irony is that this is actually a good news. Okay. So you are the problem, it means you are the solution. So you hold the key. Okay. So you need to get out of these, odd ways and actually stop hurting yourself and try to correct the problem. Okay, all right. So we are the best, okay, but sometimes we continue to fool ourselves, okay, because only one out of research done, study done or survey done, only found that actually only 5% of patients may bother to complain, okay. Others just walk out of the clinic, okay, never come back, and then tell 10 others, okay. This usually over gathering, or gathering, or some what they call Saturday, or after, or Sunday after tea party or something. They may say not good lah, this lah, that I went to other doctor better, all this. So that's a problem. Okay, so it's just like the iceberg phenomenon lah, which we heard many times. Okay, all right. So you can be the most valuable resource in your clinic, and you are the bottleneck in your clinic. Okay. If you have seen recently a lot of news shared about the importance of nurses, especially in the hospital, especially in the wards and so on. Okay. But equally important is the doctor. Okay. Especially in the clinic setting. Because clinic setting without a doctor, first of all, clinic won't run. Okay. Of course, you need the nurses and so on. But when we look at the practice, especially primary care, the doctor is actually the most valuable resource. Okay. But sometimes you can be the bottleneck, especially in a single practice where you're practicing without any help. Okay. So what is important is having a good time management. Okay. So what makes the problem worse is definitely smartphone. Okay. So our attention frequently diverted. Okay. Any new message come, we want to read. Okay. Any new email comes. Okay. And to read, and all these scammers are sending, you don't know what. Okay. They even sending a notification that your Yahoo subscription is okay, over, okay, payment. We never paid for Yahoo ever. Okay. I don't know, these scammers, they are one occupation lah in the underworld. I think the top occupation in the underworld. Huh? Okay, scammer lah. Huh? So the scamming people, they send all that. So sometimes become very stressful as well. Okay. All right. So sometimes you have to remember, okay, you have to delegate your time for others. Okay. All right. Not only for your clinic life, but your family life and something else. Okay. And then you get involved in negligence, or you are summoned by the court and so on. You have to make an appearance lah. Okay. All right. So sometimes you become like a daily wage earner. Okay. You depend on daily to daily. Each time you close the clinic, every day you close the clinic, income loss, because the rent still need to be paid. Okay. TNB still got a minimum charge or whatever. Okay. Inda water still are charging, and fuel and all these charges. Okay. Um, any one of y'all in the GP practice, uh, how much do you pay for the signboard to be displayed on your in front of your clinic? Anyone here from the GP practice? Anyone want to say
Hi,
something?
doctor.
Yes,
Doctor,
Ruben
to be
here.
honest, I really can't. Yeah, I can't remember now, but I remember
Yes.
it was a very tedious process because we had to go through Dewan Basel and Pustaka also, and then we have to pay, I think
DBKL
10
lah.
ringgit or something. Yeah, DBKL. No, no, not DBKL. Dewan Basel and Pustaka, DBP.
Oh, okay.
So because they have to make sure that the wordings are all correct, and then
Okay.
after that, from there, once they approve, only then when we have to start doing with the higher
DBKL lah,
level.
or whoever lah,
Uh,
MPS
uh,
or something.
for me, it was NPSJ.
And
So,
if I'm not mistaken, it comes in thousands, right?
yeah, doctor, but I can't really remember. This was about 5 years ago.
Yeah. So the expenses, yeah, thank you very much, Ruben. So you see the expenses, and those have a bigger signboard or more than one signboard, you have to pay more lah. Okay, all right. That's why you see some clinics that was previously 24 hours. Now they close at midnight or slightly earlier than that. They never change the signboard. Okay, because of this tediousness lah, you have to go through the Dewan Bahasa dan Pustaka. Okay, and the forms can be, I think, quite quite challenging. Take time. Okay, all right. And of course, you have burnout lah, because not enough rest. Okay, too much of work, not enough rest. Okay, example like you have to do this, do that. And sometimes when the computer, if you are using a EMR, the computer pula buat masalah, especially after a long holiday or on a weekend and so on. Okay, all right. Okay, so even though I mentioned you have five, but usually just four principle. Okay, of time management. The first is set priorities. Okay, which need to be done. Okay, your main priority is what when you are in the clinic. What is your main priority? Anyone want to say something? Okay, let me just see. Okay, balik on time.
Main priority is to make sure that the clinic runs efficiently, your staffs are working efficiently, and also for your patient care.
Yeah, yeah. The main priority, of course, is patient care and, of course, managing it properly lah. Okay, not balik on time lah. You cannot balik on time because, especially you're running the thing. You want to actually, if close at 5, maybe 4:55. You want to close the door or stop accepting patient. But if any patient walks in at 4:59, let's say a child or someone with emergency and so on, it's our duty actually to accept lah. Okay, if we don't accept, then maybe we may face trouble. Okay, so so that is the thing. Okay, second is to actually teach our staff certain things. Okay, even like putting the ECG leads. Okay, helping in dressing. Okay, wound management. Okay. Then other things as well. Okay, initially a lot of duty. If you get a new staff, you have to teach them about the registration, even communication, and then helping in these procedures and so on. Okay, even medication dispensing. So any one of y'all still practice the principle of checking your medication before your nurse dispenses it? Do everyone do that still?
Yes.
Okay, so you should be
In,
done, because you just need one mistake. Okay, and the story will reach the press and get blown out of proportion. Okay, all right. So just be careful. I guess it's still important to, even though the nurse is senior, mistakes happen. Okay, it's better to check. Okay, you just take, I think, not more than 1 minute. Okay, and they can come in while you are seeing another patient. There is no issue. Okay, the patient also will understand. The patient also will, that you are seeing now, will be appreciating that you are doing it for the other patients, and will do it the same for them. Okay, and sometimes you have to just say no lah. Okay, maybe some sales rep will come, between you are busy, they just say they need 5 minutes. It's never 5 minutes lah, it's usually 10 minutes, 15 minutes. Okay, so maybe you need to give an appointment lah. Okay, okay, so and the thing, okay, and then organize a work area, must be quite neat. Okay, you don't need to have a flower pot, or you don't need to have like fancy table, what they call, table light or something. Okay, like a hotel or something, you don't need, but at least organize, so things are easy. Make sure all the batteries are changed. Okay, and everything is working lah. The stethoscope also easy to find. You don't need to like study where is the stethoscope and so on. It's visible in front of your eyes and so on. Okay, let me just go on next slide. Okay. Okay, so I managed to, at my time as an academic, okay, initially the 1 2 years, I mean, I was doing quite a number of things, but actually at the third or fourth year, I find myself very stuck with a lot of work. There have been papers which me and my fellow co-authors have been working, but it's stuck. So, there have been a paper that was stuck, even for 1 year. Okay, but I decided to do a principle or embargo. Okay, I have not copyrighted this, but this is something that I figure out to do it. Okay, and I've named it as Lanka Mlawati. Okay, why? Because I stay in Mlawati, town Mlawati. Okay, all right. As you got this Lanka Sheraton, Lanka what they call, Dubai or whatever. Okay. You also got this Lanka Melawati. Okay. All right. So things that you should do it now, do it soon, put off until later, and doesn't need to be done. After doing this principle, I look at it, what work was actually stalled for very long and what work, need to be done. I still need to teach. I still need to, okay, I still need to do certain things like attend clinic or see, become the PIC and so on. I still can't, can't just leave everything aside and do it. And following this principle, within 1 month, I cleared a lot of papers. Even I started writing and so on, and then the others managed to chip in and we cleared, okay, and do the other things as well. All these, even for grants and everything, and it worked. Okay, so you can use this principle at the time when you get stuck. Okay, then you have to reorganize what pending work, and then you decide what you need to be done, what need to be done today, what need to be done in the within the this week, next week, and so on. Okay, some that not very urgent, like let's say they ask you to fill up something, some form or something, that you can submit after 2 weeks. Let's say some, like uh, in our hospital, in UPM hospital, we need to, every 2 years get 2 or 3 years get this accreditation, credentialing and privileging. They give you a timeline 2 weeks, so you don't need to fill up today. Still can fill up after 10 days or something. Okay, of course you need the document at hand lah. Okay, so something like that. Okay, so you get it. This Lanka Amlawati principle embargo.
Yes, Doctor.
Okay, so sometimes you just need to do, like in your case, you have assignments, all these work and so on. So you need to rethink which one you need to do first. Okay, all right. This my slides I need to put next. Okay, all right. So it's important to teach and delegate duties. Okay, so don't do the everything lah. Okay, so create a clear SOP with a due date. Okay, remember there is a learning curve lah. Be patient, okay, and follow up. Okay, let's say delegate something, some duties and so on. You need to follow up, but don't follow up in a very rush manner and very harsh manner. Okay, just follow up. If not done, then see what is the problem and solution lah. Okay, and also don't dump all the work on assistant lah. Okay, sometimes things that you can do, you help out. Okay, if your assistant or your nurses are helping with claims and so on, okay, PMK, AIA and so on, when you're free you also can help out, okay, just to show that you're part of the team lah, not only like pushing it and so on. And then the worst part, if you push it to them and they don't do it on time, then you get angry and scold them and so on. That shouldn't be the thing lah, because who at the end gets the money? Okay, they don't get the money, they get salary, the money all comes into your account. Okay, all right, so remember that. Okay, so you have to actually participate lah. Don't put undue pressures on people when you yourself are not doing. All right, so what is this? Okay, all right, so there are three domains or buckets as we call it, where your time goes lah. The most important is the doctoring time. Okay, so you do your what you need to be done, and also a downtime. Sometimes between waiting for patients, or rushing for clinic to clinic, there's some wasted time lah. Okay, and but when you delegate your duties, you get the extra time. This time will come under the doctoring time. Okay. Yeah. All right. So your downtime, okay, make use of it, okay. Time lost for meeting patients and while commuting, okay. There are some group of patients that I think I find it very strange when they come into the clinic or so on. The patient is still in the house or still in the car or something, Then after they register, they start bringing in. So that is actually some time loss. Okay, I'm not sure why there is a practice as such as that. Okay, it's very strange and odd practice lah by the patients. Okay, so while you are waiting, enrich yourself with knowledge and so on lah. Watch your GCFM, your lecture notes and so on, so that can pass at the upcoming exams and so on. Okay, so of course, sometimes we are late in finishing our work. Okay, all right. especially the certain days like Mondays and so on. After public holiday, there will be a extra load of patients. Okay, all right. Um, it just makes you wonder at times, when we still see patients that coming, after a few days, with cough, flu, fever, despite despite we had this epidemic of COVID, or this influenza and so on, H1N1 in the late 2009, 2010, okay, and we had this COVID in 2020, 2021, but still, I think the urgency is less among the patients, okay. It's after 3 4 days, they are willing to wait a long weekend and come on Monday or Tuesday, okay, and then so that a bit of problem. Sometimes symptoms are quite bad. You need to do the test or maybe need to refer and something, okay, so that creates a lot of backlog and bottleneck lah in your clinic, okay. Another problem is the staffing issue, okay. So the main complaints of your staffs, especially those private practice, is actually the clinic long hours, okay, and need to work on public holiday, okay, and certain public holiday are not gazetted as public holiday, okay, meaning they work, they don't get extra, okay. But of course, like certain public holiday like Merdeka, National Day, Agong's birthday and so on, you have to pay 3 times lah, okay, if you open your clinic. But certain days like even like Vesak, okay, example I just giving, Awal Muharram and so on, okay, so it may not you gazetted as public holiday in your clinic, and and they are not paid extra, so you have to look at that, okay. So sometimes in your clinic also, while you're treating patient and you want to go back, okay, it's 4:59, suddenly a patient comes with chest pain. So what would you do? Okay, would you turn off the patient, ask the patient go to the nearest clinic and so on, without even looking at the patient? Okay, all right. Or would you have to still, uh, still see the patients and so on, do a ECG, refer, and if you're aware for ACS, actually we need to call the ambulance, and you need to call the ambulance and wait for the ambulance to come, okay. um, with the ambulance don't and the ambulance also nowadays, I don't know, my experience, the ambulance is actually, sometimes they use some discretion also, whether it's actually very urgent. Okay, and they don't come like 10 minutes, most ambulance will reach 20 minutes, 30 minutes, some even more than that, okay, all right. So sometimes you will have a problem in scheduling, okay, patient don't come on time, okay, they come late and so on, okay. Then of course, this is one of the most challenging part, okay, for a GP, okay, the heart sink patient, okay. They got many complaints, okay, and sometimes very problematic, but there's a way to deal with it. Later we will look at it. How can we deal with this heart sink patient? And also sometimes we spend too much of time with patients. We get very engrossed and so on. Okay, so that also creates a problem lah. So we should have like a standard. Okay, generally you should not spend more than 20 minutes for one patient lah. Okay, that was the advice I given when I was in the outpatient clinic in when doing my masters in family medicine. Okay, so because you will have that in the morning, between 16 to 20 patients, okay, and then in the afternoon another 12 to 16 patients, okay, and because we are doing a fully EMR, you have to put all the notes inside, order medication, and some patients you need to refer to the for scan, some to the emergency and so on. So it takes a lot of time. Definitely, if you don't follow that time, or you get all these things, definitely, lunch also, going to lunch is a great challenge. Okay. Okay. So always have like some meetings and so on lah. Okay. What the waste that time is wasted, come up with strategy lah. Okay. And always be supportive. Okay. So people like to work in organization or clinics or hospital that is supportive. When it's not supportive, it's punitive, people get very discouraged. Okay, would you all agree with that? that statement?
Yes, doctor.
Of course, doctor.
Okay. So, but why is our superiors, our bosses and so on, okay, or we ourselves, if we are bosses, we are not able to do that. We create an environment of hostility, that is not supportive but punitive. You do mistake, you get fined, this, that. Why is it not supportive to support? Okay, you make a mistake, you are human, okay, you made a mistake, let's work on it, okay. And really you can't, if you really don't improve, then look at other strategies lah, okay. But it's always like that, it's like, everything is money, and caring and human support is very less. So we have to look at back, at how things are working. If the environment is supportive, we are happy. I just bring back you to my days. I was a MO in orthopedic in Hospital Ampang way back in 2000. Let me see the time. Around 2006, 2000, around 2007, 2008. So there was in orthopedic, we always say the environment is very relaxed, cool, but the strange thing, the environment wasn't cool in my department. But then, in the ONG, the environment in Hospital Ampang was very cool because the HOD was very good, supportive. And in fact, some of his MOs were not doing, pursuing ONG, they were want to do MRCP. But you always give them like time to study and so on. A very supportive, very kind person. Okay. So you can see, so where people will stick and where people don't stick. Okay. So you see the difference lah. Okay. I've seen the best and worst. Okay. Support. Okay. Either in the private or government. Okay. So going back to the patients, okay, how do they select a doctor? Okay, what do you think among all this? Okay, convenience, cost, clinic ambience, reputation, referral, parking availability, locums. Okay, what do you think is the most important consideration for a patient? Okay, let me see. Yes, I get up to date now. Is berapa? 11. Okay, I must see the one. So reputation, parking. Okay, cost, reputation, parking. Alright, banyak said. How about locums? What is your what's your opinion on locums? Do locums affect whether your patients come and see? What do you think about it? Okay, so I do agree that most patients will prefer resident doctor. Uh, and some do say that locum can cause, can also help. Okay, but of course, resident doctor they always want to see. Okay, and we have instances of patient that after learning that the resident doctor person in charge not available, they will walk out. Make you think why they actually want to come in the first place. Okay, they can wait next week, even up to next week to see. Okay, so it's a very odd thing. Okay, so all this pay equal, I mean, either equal or almost equal. Okay, because if you got not parking in your clinic, if patient get saman or something, they double park, triple park or whatever, they may think twice before coming next time. Okay, and if you are so charging very expensive, okay, without any reasonable explanation to the patient. Okay, so one thing that help that if you want to charge that your charges will be high is during your consultation. Of course, in the normal consultation, like Dr. Kavi mentioned, you need to mention the medication, how long and why you need to take. But if the medication may cost more for certain reason you are giving to the patient, like because the severity of the illness and so on, evidence based, then you need to explain to them. That can actually reduce they can actually improve their satisfaction. they actually can improve their satisfaction. Okay, yeah. So Aravindra Jyoti said, so reduce patient doing locum, regular patient call to check the doctor before coming. That is a very funny thing, huh? That, they will call. Okay, imagine, if you are a pregnant lady going to the hospital for delivery, you can't choose your doctor. So why in non-urgent case you choose a doctor? Whoever also should be a qualified. As long with APC, they have gone through the housemanship. Okay, and got the APC. That means you are well qualified to treat the patient. But I don't know, the perception is such among our patients that is very odd at times. I would say, okay, all right, they call, which doctor and so on. Okay, and I don't know. That's the practice in Malaysia. Okay, let's go to the next slide. Okay, so the patient perception of your practice is important. Okay, so life may not always be fair. Okay, so not all busy doctors are good. Okay, and not all good doctors are busy. Okay, so sometimes you do practice evidence based. You are a bit stingy on your MCs. Okay, because you know that patient actually don't need the MC. They can get off with time sleep and still can go back to work and so on. Okay, but they're coming very late, so they are coming very late, even the day after. They're requesting for backdated MC and so on. You have to practice according to what is the guideline provided. Okay, because you don't know what happened the day before. Okay, a lot of things can happen. Okay, the patient may even be involved in some legal cases. They're involved in some accident, fights, and so on. And if you give a MC a backdated, that is quite risky, lah, especially if they had this incident the day before. Okay, we don't know. All right. So you also find practice that that got a lot of complaints on the Google. You can see the Google review. But you see that practice thriving. Okay. Uh, so who are these people that are complaining? Okay, who are these people that are complaining? Whether they are real patients or not real patients. Okay, because you see these clinics are really doing well, and those clinics that are praised, like up to heavenly level. Okay, they are not doing so well. Okay, so what is happening? Okay, all right. Okay, so we is difficult. Okay, everyone is fighting against each other for business. Okay, so it's no point complaining. Learn to accept reality. But what helps is actually the soft skill like IT communication. Okay, handling complaints and criticism. Okay, all right. You may not know from one patient. You may get many others that may come. Okay, because of that recommendation. Okay, so communication is very important. Okay, take your time to communicate, your what is your diagnosis, what is your plan, what is your treatment. And I've seen see I still see on Google review complaints like um doctors not examining. Okay, patient complain of back pain, just say okay, makan di subat and all that. So I don't know, is that still happening? Doctors not examining, especially those that higher locums and so on, or those in a senior position, you get complaints about the junior doctors that don't examine and so on and just give medication. Do you still get that kind of thing?
Yes, doctor, still got, especially with foreign workers. When they come, they say another doctor don't even touch them.
But for foreign workers, is it during the Formula checkup or routine consultation?
Routine consult, doctor.
Okay, so why is that? You think
I don't
all?
know, doctor.
Yeah, so it's very sad lah. These things are happening. Uh, when I was a medical student under in UPM, I was attached to HKL. I met a very interesting Punjabi doctor. Okay, very senior Punjabi doctor. I think in that time his age was 40 lah. I'm just reaching 20. He did mention that that he still notices some doctor, especially junior. He has been very long in the HKL outpatient lah. Of course, after a while they moved the outpatient out to Klinik Kesihatan Taman Titi Wangsa. Kesihatan Kuala Lumpur, sorry, in Titiwangsa, he mentioned that some don't touch, some use this, what they call, spatula to check the pulse. That is actually not acceptable. Okay, if you do that in the exam, straight fail. Okay, so if it's not allowed in the exam, how can it be allowed in the practice? Okay, all right, when you're not observed. Okay, so people use spatula to check the pulse. Okay, right, that is totally not acceptable lah. Even how uneducated the patient, they know lah, that is not correct thing. Okay, so we need to check. Okay, so how you reach a diagnosis? History, physical examination. Okay, and sometimes you may need some investigation. If you can't manage, then you refer or get help from your seniors. Very simple, not rocket science. Okay, it's very simple, as been done. Okay, if you're still not sure, you can read up some the memes or something, how the dosage and probable diagnosis and so on. Okay, it's still the same step, nothing more than that. Okay, whether you're not sure about the medication, the doses, you can even ring your pharmacist. They'll be very happy to help. At least you regard them. Okay. Okay, we go to the next slide. Okay, so staff, your most valuable ally. Okay, I still believe the doctors are still the most important. Then the staff comes next. Okay, especially in the primary care. Okay. Okay, so sometimes staff are not treated badly. So the environment, as I said, become punitive. Okay, finding faults instead of supportive. And there is a lot of politics also, if you have been working in the primary care. Okay, after a while, there is some some camp, some people that get they are very senior that may undermine the juniors and so on. Okay, so I'm not sure why this happens. Okay, because these people that are senior now actually were junior before. Okay, they also struggle to learn. Now they are senior, they know more things, doesn't mean they are, they don't need to teach their juniors. Okay, because that's the usual manner lah, that Hippocrates even mentioned that. Okay, all right, so that is the usual, the cycle, that you go on. Cannot be a break in the cycle. Okay, we don't know why is it is happening, but I've noticed it in some clinics that this is happening, which is very sad. Okay, all right. So sometimes the doctor itself are guilty because they underpay them, scold them, not respected. Sometimes in front of the patient, we scold them. That shouldn't be a practice. Okay, be sarcastic in front of the patients and so on. Okay, that is not right. They of course overwork, not paid their allowances if they work on public holiday. So not only a doctor, sometimes you allow the patients even to misbehave. Okay, without defending them, and the behavior is not tolerated lah. Should not any abusive behavior not tolerated. I find very interesting when Dr. Anis mentioned that top officer from JPA got what they call, got demoted. I was there was a moment of joy for me from hearing that. Okay, no matter what is your position, you should not use your position as a cover for give. Nothing gives you authority to mistreat anyone. Okay, of course sometimes we, because our stress and work. Okay, so if we do that, then we must quickly apologize. Okay, okay, and settle it. Okay, don't think you are so great. If you are really that great, then why you come to the clinic? Okay, you can go to the pharmacy and use your credit card and buy the whole pharmacy. So you can treat yourself. Okay, so never tolerate nonsense. Okay, and remember now, as Dr. Anis said, you actually can complain to the employer, right? Someone is verbally or abusive against you. Is that right?
Yes, doctor. He said yes.
Yes. What if someone threaten you? They will, hurt you or something. They don't actually do it. So this you actually can complain to the police. Okay, when they use like this word that they want to harm you, or they actually, do something against you, push you or something, which has happened before, then you can actually go to the police, okay, straight report, okay, but you need to have evidence lah, okay, otherwise very difficult, okay, because the next thing the patient will say, no, I never did. So what is your evidence? Okay, so sometimes you need to have evidence lah, okay, all right. So as I said also, you need to teach your nurse, okay, at least by working in your clinic they get some experience, okay, in registering patient, helping with claims, doing the procedure, okay, all right. And then of course sometimes in some clinics, especially the older clinic, they are still not aircon, don't have aircon, using the fan and so on, but usually consultation is aircon, but the waiting area is still using the fan and so on. You may consider renovating and putting some aircon for patient comfort, okay, all right. And so this thing also is one of the best English phrase ever, okay. Try not to be penny wise, pound foolish. Okay, all right. So sometimes we charge the patient expensive, and then there is a great chance the patient may not return and complain to others that this clinic is expensive. And as Mr. Ranjan, once your name come up or nama naik, even not widely, okay, in let's say in afternoon tea party or whatever, Melawati tea party or whatever, okay, then then people may not come to your clinic, okay, all right. So these are the 10 rules that you can follow, okay. The patient is not an interruption. Treat everything, treat everyone well to your best ability, okay. So if you got some pending work, okay, unless it's very urgent, then you can wait, okay. So greet every patient, okay, with their name and with a smile, okay. Jangan macam patient masuk, okay, ini ubat, okay, okay, pergi pharmacy ambil ubat, that's not the way lah, okay. This applies to both in the government and private practice, okay. Even though we are having some stress and so on, we try to clear our mind, just concentrate, you'll find great joy, and that is a great stress reliever when you treat your patients well, okay. So of course sometimes patients also see how you treat your staff, okay. If you treat them well, they also gain confidence that you are good and able employer or teacher, okay. And try not to argue with the patient, let them to present their complaint, okay, listen to their complaint and then interrupt for your history and physical examination, okay. Sometimes a strategy that you can use is, say, if the patient asks you a quite difficult question, okay, and sometimes you say, I don't, instead of saying I don't know, say I will find out, okay, I'll let you know, can you give me my email or number, later. Try not to give phone number lah. Okay, email will be better, okay. All right, email is better, but nowadays they are quite advanced. They got Instagram, Twitter and so on, okay. All right, but I think email is still better because you can there is no much limit in the word. You can write very long, okay, with attachment, so okay. So the patient contribute to the well-being of the clinic, okay. So we should not elevate them so much to the heavenly, but we must know their contribution to the clinic. They have chosen your clinic, so for that you have to be thankful. And then the second thing is they may recommend your clinic, okay, all right. Not only for their friends or family, and not only for this generation, but for generation to come, okay. I've seen patients, that tell me, they have come from young and now they are already in their 50s, 60s, okay. They are bringing their children or grandchildren and so on. So you can see the positive effect of a good practice. Okay, always choose positive words, okay, all right. Instead of telling, oh, your one is very severe, very bad and so on, just say the one is quite, you need a stronger medication to battle it, but I'm sure you'll be able to come away with it, okay. And sometimes don't stop, don't say that this is not your work, your duty or so. Let's say a patient comes with URTI but also requests a referral, okay, for some other problems, okay. Maybe they want because the panel employee allows them, because the employer allows them for some medical checkup in the hospital or something and they need a referral letter, please provide it. Okay. So when you exceed the patient expectation, that is the best way of keeping the patients happy. And for one patient, you proliferate 10, hundreds and so on. Okay. So one way to actually relieve your stress and make yourself happy is actually brighten every patient's day. Provide positive word and provide them comfort and so on. Okay. Okay. So yeah, for your staff and for yourself also, follow flow chart. Okay. You may need to teach them how to answer the phone, greet the patients and so on. Okay. Initially, if they are new, how to fill up the claim form or registration form and so on. Okay. Unfortunately, in the clinics, we can't ask patient to do a lot of things on their own. Like nowadays, if you want to sign up for any if you sign in, you register for any what they call services with the government agency, even private, you have to fill up the form. And some require you to show your IC and also your what they call take your swab photo. Huh? That means selfie, right? Swab photo. Okay. Okay. A new word by Dewan Bahasa, swab photo. Okay. Then you need to do lah. Okay. It's quite lucky we know a bit about IT lah. We can do it. Okay. All right. So then you don't do it, so you can't. Even for JPJ and so on, you need all these things to be done. Okay. All right. So doctors usually create a bottleneck of doing everything, so delicate. All right. So how to make use of better time with your patient, no interruption, as I said. Okay, no phone call. Okay, and you have a phone call, you can return at a fixed time when it's less busy. Usually in the early afternoons and so on. Okay, patients usually don't come that time. Okay, so yeah, some you've got a budget. You can have all this system and so on. They can record all calls and so on. Okay. And also prepare like SMSs or email, for patients to actually communicate with you if they have any query or asking appointments or any services that instead of just phone call. Sometimes phone call can be a bit disruptive. Okay. So invest in technology if you have the budget. Okay. All right. And sometimes you do like plan appointments, let's say to recheck the fasting glucose or random glucose or blood pressure, okay, to confirm the diagnosis of hypertension or when you started the medication. So if they don't turn up, okay, it will be very nice for the patient to know that if you are able to remind them of their appointment, they'll be quite pleased with that. Okay, of course, those got extra budget, all got the apps and so on, but this you need a bit more budget. Okay, so as I mentioned, out of 20, maybe one may complain or none complain. That is even worse. Okay. The truth is, most patients are scared to complain. Okay, and will not tell you they are unhappy to your face. So, do you agree to this statement, or is there already a change in now the patient will, if they are not happy, they just tell you to your face, or still a lot will do behind your back.
Still many written complaints, doctor. Even though the consultation may seem to be like a very smooth going and then patients seem to be happy with us, but towards the end, I don't know, maybe they are dissatisfied with something, they will still lodge a complaint after that.
So you are attached where to the government or the private sector?
Government, doctor.
Government, yeah.
Hmm.
I also heard a lot of complaints against nurses and so on. Despite a lot of good things are written about the nurses, a lot of people appreciate, there are still these, what they call, black sheeps, okay, or something, moles, I call them moles, because moles, they are, they don't know what is their priority. Like these moles, they actually will complain, okay, and create problem. They don't know their complaints is actually creating problem. Even though we say the government will investigate this and all that, but if too much complaints against you also is not good. Sometimes this is the issue lah. But it seems that a lot of complaints, especially against nurses under the CISPA. Okay, all right. So let me
One
see
thing,
anything.
doctor, I just want to share. I don't know how our patients can wait for hours at private hospital despite paying like 100 ringgit, 200 ringgit to see a doctor. But when they come to GP or clinic kesihatan or what, they expect us to see them within 1 hour and all with the load that we have. How is that possible? I don't understand how's their thinking pattern. They
Yeah,
pay money at private and they don't mind waiting there. But when they come to us, when they pay it's only 1 ringgit or 5 ringgit, they can't wait at all. So I don't know. Maybe
yeah.
I can understand that.
That's why it's a bit strange, sometimes very odd, as I said, okay. It's not that we are actually not patient, they themselves are not patient, they want to be done fast, okay. And sometimes there's some group of patient will be like looking through the counter, looking, peeping, whether you're sitting there drinking coffee, okay, watching a movie. Uh, there are this group of, I think it's just an expectation of the patient, what they read in the news and so on nowadays. Consultation time has improved. Patient are being seen or what they have heard. That is a false expectation that they create. Okay, so it's very good in your clinic or hospital to have that charter. Okay, what is the expected registration time, what is the expected waiting time, and also what is the expected time for you to actually get your prescription, in the pharmacy. When you have that charter right in front of their eyes, they know. So whether they want to choose to actually come to your establishment or not, especially this will be very useful in the government setting where you will take more time for the patient. So if anything, you can just say, sorry, according to our charter, as we agreed with the PKD or whatever state health department, this one, and we have been doing, we always try to see as soon as possible, but because of lack of manpower or the patient board, that is the thing. I think having that, then some of that false expectation, I say, will be shattered lah. So they will come back to reality lah. I think in the private sector they do that lah. They have all these charters, all these things in front. Okay, you already know. Okay, but also that one thing that in a lot of our patients is they also think when they go to the hospital, they are seeing the specialist. Okay, and when they come to the GP, they are not seeing a specialist. Okay, so that's why they think that specialists maybe consult longer. Okay, especially do more things. But actually, you find specialists also not very hardworking. Okay, they also sometimes delegate duties, to the nurses for blood taking, all this. Okay, maybe so it's just that perception and somehow I don't know why we have a lot of problems with our patient There's no way actually to impart that except all these non-verbal ways like where you put the charter and so on. So I also had the issue last time because in our hospital, in the UPM hospital, we try to see those with fever and so on outside the main clinic lah. We call it what they call they call CSC. Okay, something. So we try to see them outside the clinic. And treat. But sometimes it may happen that a mother may bring two children. Okay, one having fever, one of fever. So then that person actually argued that, okay, I can't leave them one outside, one inside. Okay, so sometimes you have to, then the person was asking where is the where is the document that say that patients with fever can't come in, where to find lah in a busy clinic. And I just allow and nothing happen. Okay, so sometimes it's difficult lah. We have these things, everything written and all that, everything in front of the eyes, then will be okay. Okay, so that is the issue. So we have it very clearly. Okay, in fact, make them. Uh, our government, I mean, very good. Okay, nowadays it's online. You have to fill out your registration, but they still do registration for maybe first time in the clinic, hospital, and then they do for you everything lah. Okay, and we don't give them much forms to fill up. I think in the other countries they do. give them things to read, what is the expectation, waiting time, and so on. So they know, so they won't be so complaining lah. But there is still a perception of the patients that think that okay, because they are dealing specialists in the hospital, so it's okay to wait. Okay, and the hospital is more busy than the clinics, which actually is not right. Okay, so in the clinics also sometimes can have very challenging and difficult cases to manage. Okay, it's just a perception lah that we don't know how to correct. Okay, these people are correct themselves lah. Maybe we must go back to the education system. Okay, and and correct it lah. Okay, right, all right. So CISPA also is like it's a way for them to complain lah. Actually, the original intention of CISPA is good lah, but as long as it's used as a supportive and manner to problem solving rather than punitive lah. Okay. Okay, so this to show that how well you have treated acid test. How many of patient refer their friend to you? Okay, if you always get this one, oh, the day my friend came and very happy, and that's why I also want to consult you. Or my friend also had the same condition you treated, or my son had or my daughter had this thing and you treated. Okay, so they are happy. Then you know you are doing very well. Okay, and then the next thing is how you deal with heart sink patient. So heart sink patients are people with with a long list of complaints, and these may be patients that are very demanding, patients that are angry, patients that that take a lot of time. Okay, so how you deal with it? Okay, so before we go this, anyone got any idea how you can deal with heart sink patients? Anyone got any experience dealing with these patients, heart sink patients?
Hi, Doctor. Kumutan
Yes,
here. So I'm
yeah.
working at government setting. Almost daily, we will have heart sink patients. Angry patients are more common. So I have had experience whereby I mean healthcare staff from hospital setting lah, come in on a Friday 3:30 p.m. Requesting for MC for Saturday, Sunday, 2 days because don't want to go and do on call. He is actually a ambulance driver at hospital setting lah. So walk in with a tongkat, but then when assess, no swelling, nothing. Examination pun nampak okay. So
What
I
was the
explained.
complaint?
The complaint is right knee pain. Right knee pain.
Okay,
He's in early 40s lah, doctor. No medical
okay.
illness. I mean obesity maybe class 1 like that. I already check everything. Memang examine fully lah, doctor, and then was explained to him. Assessed also regarding workplace burden, if he's going through any emotional distress and everything. So I explained calmly, telling that this is a Friday afternoon you came in. If you really need the rest, I can issue for Saturday so that you can rest, you can calm down, and then we can provide analgesia and everything. But he started getting angry, started shouting, tarik kerusi all, and then was telling even doctor, you cannot understand being in the same medical field that I really need these 2 days off. So okay, so what I did, I was alone in the consultation room with no other colleagues. So this is 3:30 ready kan. So my another working partner was at different setting lah, fever center. He is my YM. So my outside got PPK registering. He already noticed things are escalating. He called for help for another colleague to step in. Meanwhile, I memang remain monotonous. Try not to raise my voice. Try to calm him down. But we cannot calm him down lah. So my another colleague step in. Being male colleague, he's much more senior. So he said, Cik, duduk dulu, bawa bertenang. Cik kena hormat doktor. Doktor kalau kata memang satu hari MC, Cik memang layak untuk dapat satu hari MC je. So ended up he left in angry, telling that he'll ceasefire and everything, but nothing happened. He didn't take his medication. He came in with a walking aid, walking out without leaving his walking aid behind, walking completely normal. So this
Okay.
happened to me lah, doctor.
And then MC, you all give or no?
No, I didn't issue. He angry. He say he don't want anything. He'll go to private.
Yeah, okay lah. So yeah, these things all can happen lah. So as a unrealistic expectation and some malingering going on lah. Okay. So I guess for that patient, I guess he should have known how things works lah. Okay. The government setting, we are really evidence based and we don't issue MC, and especially for this, we also know that is an ambulance driver, such a critical. Even in the private sector, also sometimes doctor are very careful to issue for this. Why he needs an MC for the next day? Okay, why he needs for the next day? Okay, is he going to do something the next day? Okay, must be very careful, assess carefully and so on. So things can happen. So these angry patients, it's just your luck lah. It's just your luck. You are chosen to get angry patient. But there is a method that we will deal with them. I will mention. Okay. I want to specifically mention like the heart sink patient. So patient come with a lot of complaints. So sometimes you can't deal with all. You can just say that okay, I will deal with problem 1 and 2 because that looks like the more urgent. And then maybe I give you a follow up. Come back and we'll deal with the others. Okay. That is for the patients with a long list of complaints. The patient that takes too long for consultation, you can just like, just say, oh, I'm sorry because I got the next patient quite urgent. Maybe I'll deal with this first, okay? Later on, if you have anything, maybe you can come back the next day or something. Now, of course, angry patient is the most one of the challenging, and sometimes it's very stressful for us, I would say. It causes us to be down and feel that, we are we didn't do our best and so on. So dealing angry patient, the first thing that we should do is actually acknowledge their emotion, ask them the reason they are angry, and people use this statement, no, you look very angry today, tell me what's the actual problem, how I can help. Okay, then they will calm down. Okay, using that one sentence, you look very angry or you feel very angry. Okay, is there anything I can help? Okay, that actually can actually calm them down. Okay, and then later, both will be smiling at the end of consultation. Okay, so but sometimes you still get the patients that are very rough lah. Okay, because you don't fulfill the expectation. That's why they're still not happy lah. So last time we used to have problems with this prescription of glucosamine and so on. Okay, so usually primary care, glucosamine is more medication given by the orthopedic colleagues. Okay, so they need to go to clinic, then they miss the appointment, then they want the uh, prescription here, then we can't give, then get very angry. They will say things like they work for the government for 30 years or something, all right, and then they are not getting it, why you don't want to sign the form. You can sign the form, but then it's not valid. Okay, that's why you're already like saving them time and trouble. Okay, if they miss the appointment, it's not your fault. Okay, they can deal with the clinic and so on lah. So we get that. I also had colleagues that were pushed by patients and so on, but then the patient, because the patient got some psychiatry problem and so on. Okay, then nothing happened lah. In between, both apologize to each other. Case closed. Okay, so it's very difficult. So try to settle everything, within the consultation. That will become very messy lah. But if cause someone threaten you or assault you, there is no, you should not let it go. Okay, lodge a report and so on. Okay, make it big. Okay, and settle it.
Dr. Naveen, just a small
Yes,
small. But
yes,
you see, that sometimes it's actually very difficult. The moment something happens, and then the whole day's mood is spoiled. Okay,
yes,
there's one. Okay, I'm sorry. I just share a small, tiny story. Like actually, this story is
yeah,
a
sure,
little
sure,
bit.
sure, sure.
I was on the next room, and my colleague was on. Let's say I was room 6. He was in room 7. So he had a lady came in with 3 boys. They came on a Monday. So they went for holiday since Thursday the week prior. So When they came on Monday, they asked the doctor to issue MCs for the wife, that is herself, and the three children, and for her husband. So what happened is when the doctor actually refused, told that they cannot give MC on that time because this is during locum hours, and they came about 7 o'clock in the evening. She started shouting and she left. She was actually, they are fine. They just went for holiday. They just want the MC given. So they
Mm.
left. And then I think they would have complained to the husband or what. The husband came in, started shouting, and then took the chair, almost hit my colleague. And then I heard the commotion. I went to the room immediately. So when he started seeing the number, and then he started shouting, and we only told what we are supposed to be done. And being teachers, they should understand about the whole system and all. But
Yes, yes.
anyhow, this is what happened. And then after that, she, the whole day up to 9:30, it's already no mood ready for her to see also.
Mm.
And me being next to her room and going and attending to her, and we just lost our intention of working on that particular day. The whole passion is gone. Is it sometimes something like a simple thing like MC really causes a very big fuss,
Yeah, yeah.
especially in clinic kesihatan. I'm not sure so much about GPs, but in clinic kesihatan, that is actually a very big problem. So when we have the negotiating period, everyone says it's a gray area. We can't say whether you need to give or not, but it comes under our during the consultation our opinion whether the patient needs or don't need. So most of them now end up you come, you ask MC, I just give MC. I just don't want to spoil my mood kind of thing.
Okay.
So when it
All
comes
right.
like this, how to, sometimes we have difficulties of how to cope up because the moment we get stuck with one patient such like that, the next 40 patient is going to have problem.
Mm, yeah. So sometimes, yeah, because we are so human, so our emotion are disturbed, okay? Especially we had this kind of clients and so on. Lah. I guess the discretion of the MC is still up to you, okay? If you have examined the patients and you feel they were still unwell today, even though they have come a bit later in the evening, you can still issue to them, okay? Uh, is still okay. But if they look well and you feel they're not entitled to the MC, then you have to explain the reasons lah, why you shouldn't give lah. Okay. But no matter how the outcome of the thing, people shout lah, throw things or whatever. Okay, you must remember your priority is still patient care. You still have to get rid of it. I'm sure the next few patients will be okay because they will provide you, you will still find the comfort in the thing, and then later on you can you have some grudges, but then just let it go lah. Okay, sometimes we can't deal, but knowing that you have done nothing wrong and you won't face any problems lah. Okay, the problem is when we get into argument, we start shouting and so on. People record and post in the media and so on. Often they get a lot of support. Okay, and then we are the one that are actually in the back pedal, and then it gets so viral then until the higher authorities will get involved and so on. And frequently we are not supported lah, unless your boss itself supports you lah.
Yes, sir. Frequently not supported because what we got is never mind lah, let it go lah.
Mm. Not support, yeah, let it go. So it's very difficult. I sharing my experience. I work in the also. Okay, so always have some issues lah initially. Okay, so but then after a while, after doing it, then you understand and you know how to deal, and you're a bit more careful in dealing with things. Okay. I also had colleagues that patient was shouting, and I tried to calm down and try to take away the patient. I see lah. I see a bit more senior. So then deal with it. Same time also I had patients that were shouting at me and so on. So I seek the help of my specialist, to explain lah. That time I don't know how to handle it. Okay, I tried not to make it, but no complaints lah. Thank God. Came from the patients, except the Putrajaya story we share with you shortly. Okay, all right. So sometimes we our emotions are disturbed, but remember your priority is still patient care. Okay, so don't let your emotion later can deal with it at the night. Okay, calm yourself, maybe get what a nice burger or get something, some nice food, and watch your movie or something. Okay, well, don't give up lah. Don't give up. You still have done good. Okay, you have done according to the thing. But just in the sake of MC and all that, don't be so rigid. Patient is really unwell, even though they have come late, you can still issue. There is no law saying that patient need to come in the morning. There is no law. Okay. Uh, Saying that, okay, patient can't ask MC for next day. There is no law. Only backdated, there is some problems if we do issue because of the, patient don't know what they did on that day. Okay, they may face a problem legal, so you don't give backdated at all costs, even for school students. Okay. But those current and the next day, I think is quite fair lah. Use your discretion. Okay, and if people ask you why you're giving for tomorrow or the same day, justify a reason. You can say the patient really unwell, and couldn't come in the morning because of some reasons or something. You can still justify. Why giving for tomorrow? You think that treatment will at least take 2 days. Okay, to be effective lah, patient need to rest. Okay, just that only. Nobody can say anything. Okay, if the patient, somebody try to say something, then they are doing wrong because they never see the patient. Okay, how they know the patient? They cannot guess. You can just tell them, in medicine you cannot guess. Must be evidence based. Okay. Yeah. So the environment must be supportive. Okay. The environment must be supportive. I remember this incident also when during the time of our PMX 8 7, I think, Dato Sri Najib, his time 6, I think, is a PMS 6. Okay. So he introduced one scheme where you get discounts using some card for your KLIA Express. Then so KLIA Express, actually they were not happy about this because they I think they were forced to give you a discount 30 something or something. Remember when you were something, you get this card. So what happened was they used some problems in the card, the technical problem in the card. Some registration number gets wiped off, or the expiry date get wiped off easily. And then when the next time I went to the counter, to get my discount, they didn't want to give me. And I made a complaint. I say, why you don't want to give me? Not shouting or something, but I say, why you not giving me? This card shows the thing. So they say expiry date, not you should go Bank Rakyat and clear the thing. But you see, despite I'm feeling bad, but you see how that support system is there in that workplace. So how the employee will feel, like employee will feel very good. The manager support him or her. Okay, I can't remember. I deal with a guy or a lady at that time. You see, so that's the way things must go. Okay, you support your staff. Okay, there's no point supporting someone that that have started the whole incident and so on. So sometimes that's the issue lah. We face lah. But knowing that if you do your job well, you got nothing to regret. And the next day you'll feel much better and fresher. Okay, go to the next slide. So also one of the problems that doctors become so stressed, and it's so hard to learn the soft skill, is also medical training is very hard. Okay, it's 6 years, and some take more than 6 years. If 5 years, 6 years, 7 years, whatever is it. Okay, and kills our humanity. Okay, then sleep deprivation, fatigue means especially junior doctors are very overburdened. Then get to deal with all these patients and so on. So later on, the humanity is less. Okay, you become like very tak peduli lah, tak peduli, you like not bothered, you just want to finish the job. Okay, so if we treat our juniors, our housemen badly, okay, they may in turn treat their patients badly, or their juniors, they may treat badly as well. So at last it comes to you, and you have to deal with this problem. Okay, you want to become a good role model. Of course, if they make mistake, you can actually correct them. Okay, use a bit more strict words, but never shouting, and also support them. Okay, seek a solution. Okay, and sometimes you have this poor illiterate patient that are scared and will not speak up lah. Okay, and And sometimes we have this attitude as healthcare professional, we don't want to learn anything new. Okay, all right. And sometimes they're very argumentative. Okay, if you go some of these medical association meetings and so on, you have all these some senior people always like not happy with the secretary report, not happy with the treasurer's report. Okay, but they got no evidence to back it. They say this, that, wasting money. But when the treasurer explain and so on, then they tone down and so on. Sometimes you do get these people, this kind of people. Okay, so the moment of truth, sometimes there will be sleep and lapses. Okay, so master the service art or service recovery, take ownership of the problem, and never abandon the patient. Okay, try to find a solution to their problem. Okay, so handling difficult patient. Okay, so you can use this acronym, sorry. RESPEN, so re-establish a rapport, agree. Okay, what is the problem? If you have a long list of complaint, maybe just deal with the most important and follow up on the others on the next appointment. Seek a solution, okay, and then can ask the patient are they happy with the solution they offer, then give some follow up and document carefully. Okay, all right. So for angry patient, of course, the statement you should make, you look very angry. Is there anything happen in your work or on the way to work or on the way clinic that I can help you with? Okay. So find something to agree with. Okay. Allow them to actually distress, cognitive reactive action. Okay. They call it A plus, no relationship with the ape, animal ape. Okay, all right. And then E is emotional express. Okay, acknowledge their emotion and give the options of plan. You can even ask them, Lama, you can go and come down and have your lunch or have a bit of tea when you're a bit okay. Just knock my door when I don't have patience. I'll call you this thing. Okay, so the last few slides, just let us see what the commonest complaints patient have about doctor. So doctors did not explain properly. Okay, this is not uncommon. So even some don't examine properly and so on. Okay, so doctors appears to be rushing, even though sometimes you have a big load of patient, but you must not appear to be rushing. You must actually cover the essential history, physical examination. There is no shortcut. You can't, the patient complain of sore throat, don't even look at the throat and so on. Okay, don't check the temperature and so on. There is no undefensible, as Mr. Ranjan would say. Okay, and then sometimes you get very chatty or doing other things during the consultation. Okay, which you can do later or not urgent. Okay, so that creates a long waiting time. Of course, your staff itself are rude. Okay, because of the stress and they get scolded by you and so on. Okay, and then sometimes unnecessary medication, prednisolone for sore throat, giving Gelusil along with analgesic when it's not indicated. Okay, all right, giving antibiotics for AGE. Okay, when it's very unlikely is bacterial in origin or will bring any benefit. Okay, of course the danger is a poor documentation. Okay, sometimes if you write manually, the MC can't see the data and so on, not very clear. So sometimes you also unfortunately have to deal with other doctors angry patient. Okay, so they may have come earlier, then they come back, they say the treatment didn't work or wrong diagnosis. So what you need to do, these strategies, learn to give second opinion tactfully, highlight the correct things that the earlier doctor has done, and while suggesting some changes. So I also had a personal story while doing the masters at UM. Okay, so I saw a couple. Okay, a couple bringing their two young children. I think one was 1 year plus, another one was 3 years. Okay, so they come, at Friday. They just like, I think, past the registration time, but then because they are children, they are still taken in. So I willingly saw them about one something. Okay, because I just finished my last the patients before them. So I saw these two and treated them well. Okay, one was having like few times of vomiting and so on. But then the standard treatment as provided a pediatric protocol since wasn't so bad. Still can take some milk and so on. So give some ORS and so on. Okay, another one was having URTI. I think I gave some medication and so on. So what happened the week after? My HOD, HOD came and say, we received a complaint from the family physician at Putrajaya Clinic, one of the Putrajaya Clinic. His patients went there and complained that the doctor in the didn't treat them well. Discharged them, and then when he took the child to the hospital, admitted, admitted, just for vomiting and so on, lah, just for hydration, okay. But then she asked to look into my notes in the EMR, and she said, I totally got a different complaint from there. What was complained to me and what you write here is totally different. Then after that, she see the documentation saved me. Okay, then no further comment. She just left. Okay, so you see how a correct and accurate documentation can help you. Because I remember I still, for the girl, I think the girl 3 days fever and so on. They are coming in the Friday afternoon. Still do a blood test for that 3-year-old child, and the blood test was normal. Okay, still willing to do the blood test. At the afternoon time, lunchtime. The nurse go and send urgent and so on. Got the results, and still they complain. Okay, so it's very demeaning and very depressing lah. But then you still don't hold your fort. So correct documentation saves you. Okay, and very detailed. And then after that, my HOD never see me regarding this case, so I know that she was very happy with my documentation lah, and she know the patients maybe making up things. Okay, of course you go private. The easy case, of course, they admit, right, in the private hospital. They can make money, and someone she got panel and so on. Okay, and then sometimes you get angry with this patient, but you just maafkan them lah. What to do? Okay, all right, you cannot do anything. Okay, so tips for a good practice. Okay, make sure you got software that is working, got backup and so on. Okay, and learn to get patients feedback and all that. Okay, and treat your staff well. Okay. So the secret of a good practice is treat all patients as equal, respect them. So the lifetime value of a patient is invaluable learning tool. Nothing teach you better than the patient. Most patients are okay. There are some patients that are problematic. Okay, and that we should not let us down. Okay, we should actually not give up on it. Okay, because everyone is a human. They have their plus and not lah. And if they get over, then you can use the law lah, to save yourself. Okay, right? The law is there. Even complain, against a superior person if they have not behaved appropriately with you. Okay, yeah. We know about that case of a person. Remember a case of some a top PST official that made some noise at the airport, KLIA airport, and then some very strict action was taken against him. Okay, after he get into viral and so on lah. Initially he changed the story and so on. Okay, he changed the story that he was going to check and all that, how they are doing things and so on. But actually when they found out he was very verbally abusive and so on, then I think some very strict action was done lah, to him. Okay, so at least he learned the lesson. So what, you are a big officer, Jusa, whatever. This is just sementara. Once you are no more in the government, you are nothing. Okay, you are just a retired person. Okay, so they have to realize that. Okay, so thank you very much. Any questions you have? We got about few minutes to deal with it. So I finished a bit late. Okay, all right. So now it's 12:09. So you have any things you want to share? We still got 5 minutes.
Hi, Doctor. Can we get the slide?
Okay, I'll put it first. Let me close my slide first. Slides, no problem. It's just that what they call these things happen lah. It's real things. Only people, if they come to the ground, then they will know it lah. Like Dr. Anis goes to the ground, that's why you will know it. You will know these issues and how to deal with it. But sometimes it's very difficult to change things as it is lah. Because what happens is okay, I put in the chat. You can download it. Okay. It's very difficult unless the change is from the top. Okay. As you see in the generation end game also, the intention was very good, but then because of various factors, political, economical, and so on, it didn't go through. and there is no mention about it lah, till now. Okay, I felt the policy was good. Okay, but then there was nobody to push it lah. Okay, there were delay Delhi and so on. Okay, if any policy they want to do, actually they can do it urgently also, within a week, you can get it passed. Okay, but then very difficult lah. Okay, and I do hope that these TPAs and consultation fees can be sought out amicably lah. Okay, at least they will increase to a fair amount, at least 20-30%, okay, of what is the current rate. Okay, or bundakan it lah. If let's say 10 ringgit, make it to 15 or 20 ringgit lah. The minimum charge must be at least more than a haircut lah. Okay, so now in the barber, so you do a haircut, it's actually 15 ringgit. Okay, and sometimes the haircut in the barber also is 15 minutes, or maybe 10 minutes. Then 5 minutes pun boleh. Just trim pakai the machine. So cannot be we paid lower than a barber lah. Okay, we also pakai alat kan, all that spatula, torchlight. We spend money for the seat, okay, all that medication, computer semua kan, electric semua. So it's a lot of cost. Even we are talking about the government or private. We are talking more of the private lah, the consultation. Because the specialist is allowed to charge up to 200, I think, in the private sector. Consultation 80 to 200. Again, they can't charge less lah. If they charge less, other specialist may complain. Okay, the consultation in the specialist. Okay, of course, some charge more lah, more than 200. Then they may be asking for trouble lah. Okay. So yeah, CISPA, actually the origin of CISPA is for good lah, to provide a very objective manner of complaints. But as I say, if we become punitive and non-supportive, then it's bad lah. If we become a supportive measure, then it's good lah. Okay. So the most common complaint, lah, long waiting time, as you said lah, Kumota. The long waiting time. That's why you have this charter and so on. Okay. So that's a problem. Okay, and then so as long as the environment is supportive, you'll be happy to work lah, like the KLIA Express. Even though I felt unhappy, I was taken for a ride. Okay, but I just had to pay $20 extra lah. I saw being unreasonable, but they use that technical problem lah in that cut. After that, I just cut the cut and threw it away. Bank riot, bank riot issues lah. Okay, right. So yeah. We can't do anything lah. If a team is against you, you can't do anything. You're alone there, everybody just looking to record and post it in social media without your permission. Okay, that's also a problem. Okay, issues also. All right. If you do have any questions, I think the link I've shared. Okay, I just share again. I don't know whether I can copy and paste first. Yeah. Okay, the link still valid. You can post the questions here, and we will take a break for lunch. Okay, and please join around 1:35, 1:40, and then we have the next stop on professional health. Okay, by Dr. Paran. Okay, so with that, I'll see you all in the afternoon about 1:35, 1:40, because sometimes this lecture may pop up early, so it's better to start early lah. Give them more time. Okay, thank you very much.
Mas, vamos para. Aí. Quando é que eu